Welcome to Arts for the Health of It, a podcast where you will discover creative ways to improve your health and well-being. Someone may have told you that art isn't for you, but they were wrong. Anyone can create arts for the health of it. No talent or experience necessary.
I'm just a little songbird, try to fly my way homeward with the melody, and I make the beat. Don't know where it'll take me, cause when I'm in the dark of night, I sing my way back to the light. Come along with me and your heart will see that a song changes everything. Oh, oh, oh.
Winnie and I are here with Rose and Diana. Can you introduce yourselves? Tell everybody who you are, where you're from, and how you know each other.
Oh, goodness. Diana, why don't you go first?
You want me to go first?
Yes.
All righty. Well, I am Diana Lee. I am a trained physician and an expert in health equity. And I am originally from Mexico, but I actually met Rose at Bethune-Cookman University, where I used to work, and Dr. Grace still works there. And when Rose and I met for the first time regarding the Music and Medicine Symposium, it really was her idea, and she was all excited to be able to create that. And so for me, it was a whole new entity. It was just fantastic. Somebody that has an autoimmune disorder, and I have to not only take medication, but I also use holistic approaches to, for wellness myself. It just sounded like the perfect thing to do, not only for the community, but also for the students at Bethune-Cookman. Absolutely. I don't think they were ever exposed to that before. And for us, it was a little nerve-wracking because the students had never had that before. We weren't sure how they were going to react. And I'm going to let Dr. Grace kind of finish with the rest.
Well, thanks. Well, yeah, it's funny. I don't even know if you remember this, Diana, but I actually peripherally kind of knew of Diana from really quite a few years ago at Bethune-Cookman, because I was put from the faculty association at that time as a representative to sit on this committee of the university to represent all kinds of community task force and wellness programs, and Diana was heading the tobacco-free, I remember, program at that time. So I just kind of filed that away, in the back of my mind. So when I had this idea of bringing the Music and Medicine Symposium, I thought, especially with Diana being the director at that time of our wellness center, I thought, my God, this is like perfect marriage, right? Because I don't have the MD expertise, but I had sort of the Tai Chi background and obviously my pedagogical and music background. And at that time, that was the thing. I was using, in fact, the holistic approach, and especially the Tai Chi and Eastern approach with research towards pedagogical models. And it was, again, like, yeah, Diana, go ahead, please.
I was going to say, because your personal story.
Yeah, well, I was going to say, it literally all came out when, in 2013, I came down with this horrendous lung infection. Nobody knew what it was. I was misdiagnosed and at first put on tremendous doses of prednisone therapy, and the steroid therapy just totally destroyed me. And when I was finally re-diagnosed correctly by Mayo Clinic here in Jacksonville, Florida, at that point, I was on such mega doses of prednisone. It took me 9 months to get off of it. I have to say, for the first time in my life, I think I truly got firsthand kind of taste and knowledge of what drug addicts feel like from withdrawal. Honest to God, because I was experiencing all of that. But in the meantime, I had to. I was stubborn, I guess, in some ways, but I refused to take a semester off from teaching, and especially from all my amazing concert engagements that I had at that time scheduled, because all the doctors told me you'd take a sabbatical. I said, no way. And I had just started taking Tai Chi lessons with my acupuncturist. And I thought, well, geez, I have nothing to lose, because I really was just non-functional. from the steroids. And it was acupuncture and Qigong exercises that, I'm not kidding, Richard, that made me, basically enabled me to be at least lucid and functional for a couple of days. And I continued to play and teach. But it also, I needed to almost like relearn certain things, because I literally had certain neurological disconnects as well as, physical. I mean, I used to get phenomenal sudden cramps in my hands. You can imagine, I mean, literally looked like the Tin Man that would freeze kind of. And, so how can you play, especially, right? So that's sort of what started me. And when it was so effective, I got fascinated with, with the whole idea of why is Eastern medicine kind of working, and in combination with the music. And at that time, that arts and medicine was just starting to kind of creep out into the into the real world. Honestly, that was the first time I ever actually started even hearing of some of the conferences and workshops about it. So when I really, I also,
what year was that?
That was 2013.
Yeah, so not even really that long ago. That's what's fascinating to me.
Right, but like now it's exploding, right? I mean, literally, with every month you see more and more creepy, programs, and now it's like the standard wellness of MTNA and PAMA. But I mean, back then, no, like nobody. It was the best kept secret in the world. But I also happened to read Daniel Levitin's book, "This Is Your Brain on Music." Which just and it kind of revolutionized and put everything in perspective for me. Like, oh, this is why music and Tai Chi is working so well for me. And that's when, as I said, I started capitalizing on all this research, Western research, in terms of with the Eastern approach and what I experienced myself of designing my own kind of pedagogical model for my students here, and started taking it to conferences because it worked so well. As the just literally this multi-sensory engagement of the brain. I still always wanted to somehow marry, as I said, the Western and Eastern approach and music into something more. And so in like 2018, I met this wonderful couple who kicked off. Remember, Diana, that's what I came to. Kicked off as her first symposium, David Kaplan and Stephanie Meyer-Satin from DC area. And they presented basically on Tai Chi as a routine to optimize kind of mind and body with athletes and musicians. And, when I heard their workshop, I was like, oh my God, this is like the people I've always been searching for to, put this together kind of for us. And that was the kickoff. And what we did with Diana is I started thinking, why only performing artists? Because that was the big thing, right? It was music and medicine, but performing artists, not like everybody.
Right.
So what we did in our first symposium with and using Stephanie and David sort of as our presenters was to redefine a little bit performance, beyond performing artists, like just performance functionality, right? So whether it was just an elder person suffering from Alzheimer's or Parkinson's or stroke victims, whatever neurological disorders, or just even from stress. And our students, we really did bring this with our students in mind. As Diana said, they've never been exposed to any kind of Eastern, especially approaches. This was so revolutionary for them. And it was actually exciting, I think, to see how, they were like sponges, right, Diana? I mean, they were just absorbing it. Literally, because we were a little skeptical, like how would they receive this, right? And I think part of it was credit to Stephanie, especially, and David. Stephanie, like she shared her personal story, and I think they trusted her. And that's the best word I could say. And so they opened up and they saw this amazing new way how to kind of bring in coping techniques for themselves. I mean, we were amazed at how many kids opened up saying, well, how do we deal with our anxiety and our aggression? And it was just phenomenal to see this release through Tai Chi, But yeah, so that was the kickoff. But as I said, we said, well, we need to bring it to the students, to the community members, and really redefine what we mean by performance and what we mean by optimizing functionality and performance. So the next one, we really, again, we always wanted to include the Eastern approach in there. So we had actually the acupuncturist there. And actually really talking about the relationship between especially the ancient, Tai Chi and acupuncture philosophy with indeed the connection to music, right? With the frequencies, the meridians and the healing tones. So that was actually fascinating for us. And then we also decided mental health and nutrition. We decided we had to bring everything from inside and out, right? And literally from head to toe. It can't be just kind of one-sided. So
go big or go home.
You got it. So that's kind of literally how it became so popular, I think, in terms of the demand. So we just held our 3rd annual symposium in February.
And it was virtual, I'm guessing.
Oh my God, yeah. You know, we were talking like, oh my God, are we canceling it? And as everybody else started doing virtually, I said, wait a minute, why can't we?
Right.
Yeah.
And it was amazing. I mean, it was pretty good.
I want to talk about the integration process of like what steps you had to take to get that on board and kind of get people on board to have it brought in. But Diana, you brought up a phrase that I wanted you to kind of explain more for people that might not know what health equity is.
Oh, very good. Well, health equity really is all the things that it really is the balance that a person needs to have, all the things that enter that balance so that they can have the good health and they can reach the potential that they're supposed to have. So health equity is not the same as equality, right? So equity needs to be fair for that person in particular. So somebody, for example, yourself as a young man, our health equity would be different because my needs as somebody that is older than you will be greater, for example, or somebody that may be, for example, a young Black man, you know, his needs will be different, you know, and so all of that, you know, comes together to be able to create the factors that ensure for a person to really reach their own potential. And health equity has 3 components. It has social determinants of health. Those are some of the things that determine our health without us knowing, like where we live, where we're born, health disparities, and that compares usually one group with another. For example, comparing Black women with breast cancer compared to white women with breast cancer. Right. So we know that Black women have a higher mortality rate than white women. And then the last factor is social justice. So when we talk about music and medicine, you know, we know that a lot of people enjoy that and benefit their health with music. But they're probably the greater population in the United States doesn't even know about it.
Right.
You know, and that's why I said, you know, it was a little scary to bring this, put it all together. And we were hoping that the students would, of course, embrace it. But it was, you know, and it was, you know, a little hard to imagine. And I mean, they're young and this is not their thing. And I mean, I think I can speak for Rose when I say that both of us were just so overwhelmed with happiness to see them accept it and embrace it and love it and ask more and actually feel even better after all the sessions.
Yeah, well, we really were blown away. And, you know, for me, especially, Richard, the indicator was when, as I said, like 3.5 years ago, when we were still in our normal settings of face-to-face, obviously, right? And we can talk a little bit about COVID because that's really how the training program really came about, or this you know, was the catalyst for bringing it so quickly. But back then, what was for me was just you know, like milk and honey kind of, is when we held it on a weekend and we came back, you know, during the week. And in my music history class, the kids who were attending the symposium, the first thing they asked is, Dr. Grace, can we do some Tai Chi warm-ups? I mean, and it wasn't just like, you know, one day. I mean, we literally did that for the rest of the semester. And many of them actually kept, I found out later, kept incorporating, because some of them weren't, you know, and we're going to talk about that. What was lovely is, I mean, obviously we can get fancy with all the forms and everything, but that wasn't the point. It's just a very easy, you know, breathing kind of coordination, if you will, right? The deep diaphragmatic breathing, connecting it with just some movements that everybody can honestly do. And that was, I think, also the appeal, especially I think to our students. Am I right, Diana, that it was so accessible what Stephanie and David shared at that time. So I'm just saying, so the fact that the students asked me, can we do this like as a routine? And it was great to hear that they felt it helped them just kind of focus and find their composure. And it was great. It was great.
And, that's like a positive social determinant of health. So something that they will be able to use in the future. And as blossoming young professionals that they are, we certainly hope that they will talk about it and they will teach it to others, whether it's their family, their friends, wherever they go. So it is, it is a sort of like opening their eyes to something that was not in their world. So we love it.
Well, and as I said, like with me, it started with kind of the pedagogical approach. And I have to say, the other thing that was fabulous for me is in the summers, well, except for this last summer, I taught at Blue Lake was the most recent camp where I taught. And we did in the piano department there, we did one of the sessions with the kids with these little Qigong exercises, just to see if it would in fact kind of focus them, center them a little bit. And we had them go up and perform something after it, and it was just phenomenal, Richard. I mean, and these were, by the way, like, adolescent kids, from ages 11 to roughly 15 or so. I was just stunned that after we did that little routine and we had them come up and, play a little something, they all said like, oh yeah, they like calmed down in their nerves. And more importantly, like really were focused, could breathe better. And it's just wonderful to hear somebody else say that, as opposed to that's exactly what I experienced, when I was going through that kind of, agony of 9 months. That's exactly what I felt, is just the whole system kind of literally opening up and in some sense reaching that balance, if you will.
So who's invited to the symposium? I know you had it already earlier this year, and I'm assuming there's going to be one in 2022. Who knows what form that will take, if it'll be in person or virtual. We're going to do hybrid.
We're starting to think about it. We'll see if we realize it, but I think it would be nice. Well, this year, what we tried that was brand new and again, overwhelming success, and we're actually including this wonderful expert in our training program. Heather Malek is an audiologist on hearing wellness. I heard her actually at a conference. I was so blown away with her because she is one of the very few audiologists who actually works and specializes with performing artists and musicians. I'm talking, huge conservatories, orchestras, the National Symphony Orchestra, the Metropolitan Opera, and so on. And we, of course, have a huge marching band here at BCU, at Bethune-Cookman University, plus our chorale. But you can imagine the marching band especially, right? I mean, they're exposed to, we're talking about hearing levels that are unhealthy, right? I mean, forgive me, I'm sure all the marching band directors, but it's not just that. Any orchestra musician, anybody, I used to do some work with Disney. I remember doing Disney's Pixar Live. It was the first time I was sitting there and experienced with clickers in my ears and, and headsets and the rhythm section, of drummers behind me, which I have to say as a classical pianist, I haven't really done that much. And I suddenly started worrying about my hearing wellness just from that summer. So we thought, oh my God, we've got to bring this, and especially to our community of, elder people also who attended. So anyways, it was just, am I right, Diana, just so astounding, educational. I mean, it was so revealing. And we thought, since we're bringing this training program that we'll talk about to healthcare professionals and music educators, they're all exposed to noise levels, I think, that we don't even think of that are healthy. So my point is, the hearing wellness was a smashing success.
It was phenomenal. She was fantastic. Yeah. It was one of the best sessions.
Agreed. Yes. We definitely have a mental health component now, because I think that is so crucial to us too. And we had a Tai Chi expert actually take us through a wonderful routine this time. And, we always try to incorporate some kind of body movement, whether it's body mapping or like dance therapists, and movement, things like that. What else did we have? We did something new, Diana, this year. We had our own student who was just a recent graduate.
Oh, yes.
Talk about it, Xavier Walker, in the COVID pandemic. He was doing his internship, can you imagine, in music ed in Volusia County, literally in the fall, in the midst of all of this, where, as he said, like, they didn't have a roadmap. They were making it up. No guidance. So, and I had
it's
him
the fun part and the scariest part is you get to make it up, but also you have to make it up.
So in the fall, I had him in my research senior seminar class that I teach, and it's usually their senior project, kind of a research paper. And he asked me, he said, well, Dr. Grace, I'm interning right now at a middle school here, and can I do it on the COVID pandemic and the takeaways from music educators? I thought, brilliant, original and brilliant. I said, run with it. So he did such an amazing job that I then said to Diana, he's graduating. He's going to be technically our recent alum. We've got to have him because the emphasis of this year's, symposium, even though it was still all about optimizing mind and body, obviously in general, and health, wellness, but it was COVID, fighting the COVID fatigue. That was sort of the subtitle. So I'll let you talk about what Xavier kind of introduced, Diana.
Well, I want to say that about Xavier. What it was so amazing is that, he showed us a video of when he was teaching. And, unless you see it, it's so incredible. He was teaching in a classroom setting. And then at the same time, he's teaching virtually.
Yeah.
So he was stuck in this one spot in the classroom, not being able to really move too much, but he has physical students there, live students there, and then the virtual ones, and having to split. And this is a young kid who is just graduating. And I mean, he was just so fantastic, I have to say. I was just amazed at him and so in love with him because he was just brilliant. The way he was doing it, he was brilliant.
He was.
Millennials.
Well, what I also appreciated is he also gave good well, first of all, as you said, total reality, as you said, the sort of the horror of it, but also hopeful optimism, I want to say. And so his take, right? And
he was happy.
Yeah, and that was the beauty. Is he said, we also learned so much stuff, and I feel that way too, having taught the whole year remotely here myself. There are good takeaways to maybe keep, like when we come back face to face. So
it's been sort of a silver lining. A lot of good has, especially in the arts and health community, has come out of it. There's sort of that naiveness of we'll just figure it out, because we kind of have to, and we'll see what happens. And sometimes it works and sometimes it doesn't. And it sounds like in his case, it 100% has.
Yes.
So that's awesome.
I just thought, I don't know how I could forget, Diana. Well, so the other thing that we did that was a little different this year is we actually promoted another arts organization in our area in Jacksonville, Florida, Body and Soul, who is run by a very dear friend and colleague of mine, James Jenkins. But they have a partnership with Mayo Clinic. And so we had both sort of, the Mayo Clinic research coordinator, Chris Yates, and James join us to indeed show what music indeed can do in the healthcare, setting. And that was also just fabulous. James brought some wonderful interviews, of performing artists, again, during COVID and how they were coping with it. And some of the stories were just heartbreaking and really touching. And of course, the incredible work, I think also that Mayo then does with them in terms of research. It was just fabulous. So, it was an interesting symposium.
Well, the other thing that I was going to say is that the university is located in the 32114 zip code. And that is a zip code that has been identified by all community needs assessments as a desert zone. So it's the typical urban area that you can walk 2 steps and you can find fast food, but you cannot find one single banana around you. So it is an area that it has a population, that most of them have lived there by generations, And so the only real exposure that they have to music or arts is Bethune-Cookman University.
Mm.
Yeah.
the proximity, the school is right there, but also financially, I mean, the university offers a lot of things for free.
Yeah.
A
Well,
lot of
these programs that we offer, and I mean, I also coordinate our community performance series, basically wonderful artists and guests these are all free. We never charge a cent.
I know Rose has given concerts in Bethune-Cookman's
Performing
Arts Center, and for free for the surrounding community, and they go. And I think it's just so fantastic because, I mean, that's a population that probably could not afford, maybe some of them, but not everybody. And also that it's right there. It is in their backyard.
You have no reason not to do it.
Yes.
Right? Yeah,
exactly.
Yeah. What have each of you learned? I mean, I'm sure you've learned a lot, but do you have like a story or something that you've both learned since in the last 8 years since this started?
Oh gosh.
Well, we could write a book each one.
Yeah, and you should.
Yeah. Well, for me, I guess when I left Bethune-Cookman last year, but when I was working there, it was very satisfying to be able to teach the students a lot of the things that they were not exposed before. And to give you an example, I was able to get a grant so that I could pay for health assessments for them. And so I would hire a healthcare provider to come on site and provide them with a complete health assessment. I mean, from cholesterol to glucose to physical examination to the whole thing. And so for them to learn, their health status and how they were and just things like that it was very rewarding. And for example, with this symposium, I was able to share with the students how, for myself, I am not one that meditates. I find myself a little restless. I feel like I need to keep on moving. So I'm the kind of person that, for me, meditation is I have to move. And so I found the perfect meditation for me, which is tapping, and I do tapping, almost every day. If I have some kind of anxiety for whatever reasons, like one time I lost my flight, I couldn't take the flight, I had to spend the night in the city. Then, I did tapping to sort of like bring myself back to a good place.
Can you show us and explain to us what that is?
Absolutely. And that's the one part that I was saying to you that I wanted to do. And so for tapping is really a technique that was invented back in the 90s. And although some people don't believe in it, I absolutely love it. I feel that is the kind of thing that you can do anywhere at any time, and it's free. So the first thing that you have to know to do tapping is it is based on the 9 meridian points that are always identified, for example, in acupuncture or acupressure, right? So what you do is you start with your hand, and then I'll use this one. So you put your hand like in a karate chop, and you tap very gently. And you can, bring up your anxiety, what is happening on that day. And at the same time, you are going to reassure yourself of who you are and how you feel about yourself. So, for example, I can say, even though I feel very anxious, I feel nervous, I'm about to start a new adventure, I'm going to do a presentation, or my mom is having a fit today and she's making me all upset. Although I am feeling anxious, I know that I trust myself and I love myself fully and completely. And then from there, you move to on top of the eye, and you repeat the same thing. Even though I don't feel well, I feel anxious, I feel terrible, I lost my flight and it was my neglect. And so now I have to take another one. But I know that I trust myself and I love myself fully and completely. So then you move to the next point and continue to reassure yourself, even though I feel so anxious, I feel upset, I know I'm a good person. I love myself and I trust myself fully and completely. Then it's under the I, and it's the same thing. You reassure yourself, even though I'm upset, I know I try my best. I do the best that I can, and I love myself and I trust myself fully and completely. Then above the lip, and you continue to say, even though I may have had a terrible day today, I trust myself, I trust my judgment, and I love myself fully and completely. Then under the lip, and again, I something happened today and it made me upset. And even though that happened, I love myself and I do trust myself fully and completely. And then on your kind of like in your clavicle, and yes, I'm having a hard day. And even though that is happening, I trust myself and I love myself fully and completely. And then on this side of your chest, kind of underneath your arm. And even though I had a hard day, I trust myself. I have a good judgment and I love myself fully and completely. And the last one is on top of your head, just gentle tapping. And this was a hard day, but I am a good person. I know I will be fine. And I trust myself. I trust my judgment. And I love myself fully and completely. And that's it. And then you repeat that as many times as you need it. It takes about 2 minutes. You can go in the bathroom and do it, and you feel a lot better. It sort of brings you back to a state of relaxation.
Yeah, totally.
Did you love it?
Yeah, it was like your own little massage, like your little personal massage. It was nice.
Yeah, and you know what? It's for me is the type of meditation that I need. I need to be moving. So I love it. I just find it very, very relaxing.
I love that. Thank you. You have an event coming up in August that I want to make sure everybody knows about, and I know y'all are very excited about it, and you should be. So tell everybody what's happening starting August 27th.
Yes, well, that's our target date for launching this new holistic training program that and I have to say we're so grateful with Diana, and we have actually another colleague of mine, Dr. Daniel Haller, who is joining us from Bethune-Cookman. His expertise is clinical psychology and especially trauma, in particular trauma and mental health. So he is actually on our team, the three of us. And as I said, we're so grateful to the Pap Steinmetz Foundation. I mean, for having, I guess, confidence in us,
Yes.
for awarding this, funding, because honestly, without the funds, we just would not be able to bring this. But it really is an extension of our philosophy, if you will, of our annual symposium. But what precipitated it, as I started to mention earlier, Richard, was really the COVID, I think, pandemic. I mean, we thought with Diana, why wouldn't it be wonderful if we could start offering some workshops during the year, not just this one annual event, but do something, and especially for the students, for the community. And again, we had it in the back of our minds. And then when COVID hit, and honestly, I think especially when we saw the devastation and also heard about the devastation from obviously all the networks about the healthcare workers, all the first responders, but especially the healthcare and the educators, and especially music educators, I want to say even more so, and performing artists, only because, as you know, like all our performances, and including myself, I mean, everything got canceled, right? That's the one thing you cannot do, unfortunately, still, is actually have live, I mean, without the help of obviously splicing engineers and producers. I'm grateful to them all. But the point is actual collaborative, ensemble performances, unless you're doing a solo recital, it just doesn't work. And it hit us so much in the face, both with our students, with ourselves, as I said. And then, of course, the amazing trauma of death, devastation, and illness, I think that the healthcare workers were also facing. And this need of, right, of just coping mechanisms, if you will. And that's when Diana and I seriously started saying, oh my God, like if there is ever a more relevant, right, and more importantly, more essential time to try to launch these type of workshops, basically, but as a comprehensive, program, not just piecemeal, because, we know there are a lot of little webinars now being offered, in fact, by all the arts organizations that we mentioned. And yeah, you can go and search an article and a wonderful little video, but it's all kind of, you have to do it yourself. It's all haphazard. We wanted a comprehensive, coordinated and very targeted, program, and as well as I said, all of a holistic approach, but it's validated by the Western, scientific and medical research. I mean, I think that's really where the power of our training program lies. And we thought, well, wouldn't it be wonderful if we could offer these workshops as stress reduction, as coping mechanisms, but also in the workplace, whether as a healthcare, as a nurse or technician, or as a music educator teaching good habits and postures to your students, right? If we could also integrate that aspect, how do we use our bodies properly? So that's where body mapping and Tai Chi comes in, right? And how do we optimize that usage, proper usage, in our workforce and as well as personal lives? And then, of course, bring the mental health, the nutrition, everything together, and the music, obviously. And that's literally how it came about. And I think we looked up some of the foundations, realized that Pabst Steinmetz Foundation had, in fact, a good alignment with us, with our mission, shall we say. And I think it was like 20 days before the grant was due. And I said to Diana, we can do it. We can do it.
Rose was working so hard.
I was staying up till like 3, 4 in the morning, writing the narrative, this back and forth with Diana, via emails and stuff and virtually, because we were, of course, in a virtual setting. We got it in. And I just said, okay, it would be lovely if we got it, but of course we don't have a chance. I mean, that was my attitude.
Of course.
Because I've done some other grants before that, especially federal, and it was always, they all liked the concept, but something was found and we got rejected. Anyway, lo and behold, as I said, in February, early February, I got the letter of acceptance of being fully funded. And
wow.
I told Diana I had to pinch myself about.
I was going to say.
Before I actually called her and
yeah.
said, we're sitting down, you will never believe what I just
Do we wait until we have the check in order to announce that? Or how? Yes. Yes. So how do people sign up for it?
Well, we are literally.
Are you at capacity already?
We're in the midst of doing that. But basically, yes. So we will, follow us actually, please. I guess everybody can follow us on Facebook at BCU Community Performance Series page. But we're actually almost done with the demo video that we're doing for it and brochures. But we will basically have, electronic registration and sign up. And really the first cohorts, or the targets really of these first cohort groups, are truly healthcare and first responder professionals. And as I said, educators, especially music educators and performing arts. So what's neat, and this is also where our colleague Danielle Haller is going to help us as well. We're also trying to conduct a research study out of this. So we're hoping many of our participants will be willing to, partake in it through questionnaire. They're going to be actually qualitative and quantitative questionnaires. But we really are interested to see, when they go through the series of these workshops, before and after. Because we're also going to have interactive components of modules of, indeed, Tai Chi and body movements and things like that. And obviously educational awareness of all of this. Are they going to feel, a change? Mm-hmm. Mentally and physically. Mm-hmm. And so we're hoping to get some good data out of this.
That's so exciting. I think that's what I learned from since being in the arts and health field, which it's only been a couple of years, that everything you do has to be tracked and everything is a research project is what I found out, because we're still trying to get everybody on board. So everything, you can't just do it and walk away. You have to write down what you're doing.
Correct. Well, and Richard, if I may, I know we're almost over time here, but you asked what did we learn? You know what I think, so now I've been basically involved in this for about 7-8 years roughly or so. What I'm absolutely astounded is by the people that I have met through this, whether it's in just, casually, or whether it's within the performing arts, or the performing world, music world, or especially among the scientific world, whether it's at a conference, at a school. And the stories, I have to honestly say, I think the personal stories to me of many of these individuals is what is absolutely astounding, touching, moving, inspiring. And also I sort of relate, I almost feel like they validate me, in the sense like, oh yeah, well, like what I experienced, 8 years ago, I wasn't like totally nuts for feeling it and feeling the benefits. Cause I think sometimes when you get caught up in it, you do start thinking, are you kind of making it up almost, right? And you realize, no, there really are other people. I mean, I as I said, obviously the Western research and science is clearly validating it, but that's still somehow, it's that outer, if you will, right, kind of publications, I guess. They don't have a face to me. They don't have a personality. But when you meet the people who kind of relate the similar stories, and especially some really miraculous stories. I mean, I have to say, when I hear people, especially who suffer, for example, from dystonia or stroke victims, and music is used with it, and the miraculous progress, recoveries to functionality that these individuals, experience. I mean, it literally brings me to tears to this day. I mean, every story is still inspiring. And so I feel like with what Diana said, I think what I'm seeing is with this wonderful opportunity that the Pabst Steinmetz Foundation gave us to bring this training program as a start sort of this next phase. I also see so many limitless possibilities within our community here, within the healthcare and education environment, and not just here in Volusia County, but literally in the entire Central Florida. I mean, as I said, this is exploding, but it hasn't quite exploded to the level we would all like to see.
It's simmering. It's not boiling over yet, but it's getting that. I think that's what I have found since even starting this podcast is like, you sort of feel like, when you're in the hospital and you think you're the only person who's on that floor because you can't leave your room, and it's very isolating, and you think I'm the only one that has whatever I'm in here for. I feel like oftentimes in our field, that's how we feel too. Like we're the only ones that are doing anything. And then we started this podcast, and it is all the stories that we're hearing, like yours, that you're really like, oh, there is a community out there. We're just not talking to each other all the time. And it's so fun that I get to do this and talk to everybody and really you can see everybody that comes on this podcast, you see them light up the entire time, and just like, because it's so exciting, and you just want to shake everybody and be like, no, there's a reason why we're doing this, and everybody should.
I think we all share the same passion, and I think we all see these, as I said, truly limitless possibilities and opportunities to really make them realities. And that's what I hope. I have to say, I love in the mission statement of the Pabst Steinmetz Foundation, I think Margie has something like, they love to support practice models that can have this ripple effect, which I love that phrase, because this is true. That's how I feel what our training program can do. I'm hoping it really have that ripple effect. First within our immediate community of both on the campus with students and faculty and staff, and obviously within our hospitals and nursing home facilities, and especially our public school settings, who desperately, I think, need it. But I hope it really does ripple beyond that, and that's what's so exciting. So
it is exciting. I want to thank you both for jumping on here and talking to me today. Do we have any final thoughts for the day before I let you both go? I know you're in a different time zone, so I don't want to keep you up all night.
Oh, we're good. Diana?
Well, I just want to say, I hope everybody continues to do what they're doing. I mean, that this is something that can really make a difference in people's lives. It's like I said, can be a positive social determinant of health, for people to learn about the benefits of music or the arts, in our health.
Well, and what I would like to maybe conclude with, and this is something that from some of our testimonies of professional healthcare individuals who attended our first symposium, as well as our own students, that kind of said, and I feel that way, it is such an easy way to integrate music and as I said, these holistic approaches, whether it's the tapping, the acupressure, or as I said, simple Tai Chi routines that are not, terribly, I mean, we're not, I think, here all to get black belts in it, right? But the simple, strategies that you can truly incorporate into your daily lives that do not take hours.
Mm-hmm.
They are all essentially free, honestly. I think that's the other thing. But more importantly, they're so easy and accessible, and they really do elevate all of our health. It's a question of, incremental, degrees maybe, or just amazing degrees of differences. But there's no question it's beneficial for everybody. And I think if we can, and I guess that's what I love about it, is that we have the opportunity to share that. And really, in that sense, maybe elevate not only the awareness, but honestly, the functionality and wellness of our community as a whole. I think that's what's exciting to me.
It's super exciting.
Thank you so much for giving us this opportunity too.
You can come back. We record 2 episodes a week. You can come back whenever you want, and we'll hang out because I can talk to you both all day long. Make sure you go to heartsneedart.org and click on the podcast link for all the notes and all the links from today's show. And make sure you're subscribing wherever you're watching or listening to the podcast. I want to thank you both for being here. And we'll see you or have you listen to us next week. Keep creating, everyone. Goodbye.
Thank you for listening to Arts for the Health of It, a podcast produced by Hearts Need Art, creative support for patients and caregivers, in partnership with the National Organization for Arts and Health. You can help others learn about the healing power of the arts by subscribing, sharing, and reviewing the podcast wherever you listen or watch. The podcast is hosted by Richard Wilmore, co-hosted by Constanza Rader, and produced by Ivan Briones. Our theme song, Songbird, is written and performed by Natalie Lane. Visit heartsneedart.org to learn how you can support our mission to create joy with people facing life-altering health challenges. Join us next week to learn more ways you can create arts for the health of it. The views expressed on this podcast do not necessarily reflect the views of Hearts Need Art, their staff, board members, or other affiliates. All content is created for informational purposes only. This podcast is not intended to be a substitute for professional medical advice or to diagnose and treat any health condition. Always seek the advice of your physician or other qualified health professional with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.